Female reproductive system. The female reproductive organs consist of the ovaries, the uterine tubes or fallopian tubes, the uterus, the vagina, the external genitalia, and the mammary glands. The internal reproductive organs of the female are located within the pelvis, between the urinary bladder and the rectum. The uterus and the vagina are in the midline with an ovary to each side of the uterus. The internal reproductive organs are held in place within the pelvis by a group of ligaments. Ovaries. The two ovaries are small organs suspended in the pelvic cavity by a ligament. The suspensory ligament extends from each ovary to the lateral body wall. Follicle developments. When a female is in her mother's uterus, her ovaries have already begun oocytes formation. The primary oocytes present at birth are surrounded by a primordial follicle. Primordial follicles are primary oocytes surrounded by a single layer of flat cells called granulosa cells. Once puberty begins, some of the primordial follicles are converted to primary follicles when the oocyte enlarges and the single layer of granulosa cells becomes enlarged and cuboidal. Subsequently, several layers of granulosa cells form and a layer of clear material called the zona pellicula. Once puberty begins, some of the primordial follicles are converted to primary follicles. When the oocyte enlarges and the single layer of granulosa cells becomes enlarged and cuboidal. Subsequently, several layers of granulosa cells form and a layer of clear material called the zona pellucida is deposited around the primary oocyte. Approximately every 28 days, hormonal changes stimulate some of the primary follicles to continue to develop. The primary follicle becomes a secondary follicle as fluid-filled spaces called vesicles form among the granulosa cells, and the capsule called the theca forms around the follicle. The secondary follicle continues to enlarge, and when the fluid-filled vesicles fuse to form a single fluid-filled chamber called the antrum, the follicle is called the mature follicle. The primary oocyte is pushed off to one side and lies in a mass of granulosa cells called the cumulus cells. The mature follicle forms a lump of the surface of the ovary. During ovulation, the mature follicle ruptures, forcing a small amount of blood, follicular fluid, and the secondary oocyte surrounded by the cumulus cells into the peritoneal cavity. In most cases, only one of the follicles that begin to develop forms a mature follicle and undergoes ovulation. The other follicles degenerate. After ovulation, the remaining cells of the ruptured follicle are transformed into a glandular structure called the corpus luteum. If pregnancy occurs, the corpus luteum enlarges. It responds to a hormone secreted by the placenta called human chorionic gonadotropin hormone. If pregnancy occurs, the corpus luteum enlarges. It responds to a hormone secreted by the placenta called human chorionic gonadotropin hormone. If pregnancy doesn't occur, the corpus luteum lasts for 10 to 12 days and then begins to degenerate. Uterine tubes. A uterine tube, also called a fallopian tubes, are associated with each ovary. The uterine tubes extend from the area of the ovaries to the uterus. They open directly into the peritoneal cavity near each ovary and receive the secondary oocyte. The opening of each uterine tube is surrounded by long, thin processes called fimbriae. The fimbriae nearly surround the surface of the ovary. As a result, as soon as the secondary oocyte is ovulated, it comes into contact with the surface of the fimbriae. Cilia on the fimbriae surface sweep the oocyte into the uterine tube. Fertilization usually occurs in the part of the uterine tube near the ovary, called the ampulla. The fertilized oocyte then travels to the uterus, where it embeds in the uterine wall in a process called implantation. Uterus. The uterus is as big as a medium-sized pear. It's oriented in the pelvic cavity with the larger rounded part directed superiorly. The part of the uterus superior to the entrance of the uterine tubes is called the fundus. The main part of the uterus is called the body, and the narrower part the cervix. Vagina. The vagina is the female organ of copulation. It receives the penis during intercourse. It also allows menstrual flow and childbirth. The vagina extends from the uterus to the outside of the body. The superior portion of the vagina is attached to the sides of the cervix so that a part of the cervix extends into the vagina. Puberty in females. The initial change that results in puberty is most likely maturation of the hypothalamus. In girls, puberty, which typically begins between ages 11 and 13 and is largely completed by age 16, is made by the first episode of menstrual bleeding, which is called menarche. During puberty, the vagina, uterus, uterine tubes, and external genitalia begin to enlarge. Adipose tissue is deposited in the breasts and around the hips, causing them to enlarge and assume an adult form. In addition, pubic and axillary hair grows. The development of sexual drive is also associated with puberty. The changes associated with puberty primarily result from the increasing rate of estrogen and progesterone secretion by the ovaries. Before puberty, estrogen and progesterone are secreted in very small amount. At puberty, the cyclical adult pattern of hormone secretion is gradually established. Menstrual cycle. The term menstrual cycle refers to the series of changes that occur in sexually mature, non-pregnant females and that culminate in menses. Menses is a period of mild hemorrhage during which part of the endometrium is sloughed and expelled from the uterus. Typically, the menstrual cycle is about 28 days long, although it can be as short as 18 days or as long as 40 days. The menstrual cycle results from the cyclical changes that occur in the endometrium of the uterus. These changes, in turn, result from the cyclical changes that occur in the ovary and are controlled by the secretion of follicular-stimulating and luteinizing hormones from the anterior pituitary gland. The first day of menstrual bleeding, when the endometrium sloughs off, is considered day 1, day 1st of the menstrual cycle. Sloughing of the endometrium is inhibited by progesterone but stimulated by estrogen. Menses typically last 4 or 5 days and can be accompanied by strong uterine contractions called menstrual cramps that are extremely uncomfortable in some women. Menstrual cramps are the result of forceful myometrial contractions that occur before and during menstruation. The cramps can result from excessive secretion of prostaglandins. As the endometrium of the uterus sloughs off, it becomes inflamed and prostaglandins are produced as part of the inflammation. Many women can alleviate painful cramps by taking medications such as aspirin-like drugs that inhibit prostaglandin biosynthesis just before the onset of menstruation. These medications, however, are not effective in treating all painful menstruation, especially when the cause of the pain, such as that experienced by women who have tumors of the myometrium, is not due to the inflammatory response. Between the end of menses and ovulation is the proliferative phase, which refers to the proliferation of the endometrium. During the proliferative phase, the secondary follicles in the ovary mature. As they do so, they secrete increasing amounts of estrogen. Estrogen acts on the uterus and causes the epithelial cells of the endometrium to divide rapidly. The endometrium thickens and spiral glands form. Following ovulation, the corpus luteum begins to secrete progesterone and smaller amounts of estrogen. Progesterone acts on the uterus, causing the cells of the endometrium to become larger and to secrete a small amount of fluid. Together, progesterone and estrogen act on the hypothalamus and anterior pituitary gland to inhibit GnRH, LH, and FSH secretion. Thus, LH and FSH levels decline after ovulation. Between ovulation and the next menses is the secretory phase of the menstrual cycle, called this because of the small amount of fluid secreted by the cells of the endometrium. During the secretory phase, the lining of the uterus reaches its greatest degree of development. If fertilization occurs, the zygote undergoes several cell divisions to produce a collection of cells called the blastocyst. The blastocyst passes through the uterine tube and arrives in the uterus by 7 or 8 days after ovulation. The endometrium is prepared to receive the blastocyst, which becomes implanted in the endometrium, where it continues to develop. If the secondary oocyte is not fertilized, the endometrium sloughs away as a result of declining blood progesterone levels. Unless the secondary oocyte fertilized, the corpus luteum begins to produce less progesterone. By day 28, the declining progesterone causes the endometrium to slough away to begin menses and the next menstrual cycle. The declining progesterone secretion results in a small increase in follicular-stimulating hormone secretion at the beginning of the next menses, which triggers more follicles to mature. In ectopic pregnancy. Ectopic pregnancy results if implantation occurs anywhere other than in the uterine cavity. The most common site of ectopic pregnancy is the uterine tube. Implantation in the uterine tube is eventually fatal to the fetus and can cause the tube to rupture. In some rare cases, implantation occurs in the mesenterics of the abdominal cavity. The fetus can develop normally but must be delivered by caesarean section. However, maternal mortality rates for abdominal pregnancies are significantly higher than for fallopian tube ectopic pregnancies. Menopause. When a woman is 40-50 years old, the menstrual cycle becomes less regular, and ovulation doesn't occur consistently during each cycle. Eventually, the cycles stop completely. The cessation of menstrual cycles is called menopause, and the whole time period from the onset of irregular cycles to the complete cessation is called the female climacteric. The major cause of menopause is age-related changes in the ovaries. The ovaries of menopausal women is small. In addition, the follicles that remain become less sensitive to stimulation by follicular-stimulating and luteinizing hormones, and therefore fewer mature follicles and corporal lutea are produced. Alright guys, please subscribe to my channel, put your comments on the comment section, give me your likes, bye bye, see you.